Hello and welcome to the FASD Basics webinar. As you can see, we're recording this webinar, and this recording will be available to you after the webinar has gone through the completion. My name is Stephanie Kolari, and I am the training manager at the Minnesota Organization on Fetal Alcohol Syndrome, and I will be presenting information to you on the basics of fetal alcohol spectrum disorder. This is a 60-minute presentation. We'll go over the basics, we'll show a couple of short videos, and then there'll be time for questions at the end. You will be placed on mute throughout the presentation. If you would like to ask a question, please locate the chat box on the bottom right-hand corner of your screen. Depending on how much time we have after the presentation, I will answer questions. I will also make note of the questions in case I cannot get to them, and we'll email you the answers to your questions afterwards. We'll also send you a certificate of attendance after the webinar, so you can have that for your records. Once again, we're very excited to have you as part of this webinar. I see that we have people coming from across the country, and that's very exciting. Some of the information I talk about will be specific to Minnesota in terms of our statistics, but most of the information I talk to you about will be, you'll be able to generalize with your own communities. In addition to people from all over the country, I see that there are folks from varying backgrounds. We have some parents, we have some social service providers, we have some medical providers, and once again, we're very excited to have you a part of this webinar on FASD basics. So these are the basics of fetal alcohol spectrum disorder. Again, this is going to be a 60-minute presentation that's brought to you by the Minnesota Organization on Fetal Alcohol Syndrome. Our mission is to eliminate disability caused by alcohol consumption during pregnancy and to improve the quality of life for those living with fetal alcohol spectrum disorders throughout Minnesota. Our vision is a world in which women do not drink alcohol during pregnancy, and people living with fetal alcohol spectrum disorders are identified, supported, and valued. We have a number of different presentations that we offer throughout the state of Minnesota. The FASD Basics is one of our presentations that we provide to individuals and families affected by FASD. So today what we're going to do is we're going to define fetal alcohol spectrum disorders. We're going to learn how prenatal exposure to alcohol may affect individuals and families at different developmental stages. We're also going to find resources in your area and how you can help. Now again, this is a specific training for Minnesota, so I would encourage you to locate the resources in your area if you live in, say, California, Ohio, Michigan, that sort of thing. I just wanted to note, as we go through the presentation, we're going to talk about how prenatal exposure to alcohol could potentially bring about consequences to individuals and families. As the information is relevant, please keep in mind not only the challenges, but also the strengths that individuals and families affected by an FASD live with on a daily basis. First, let's define what FASD is. Fetal alcohol spectrum disorder is it's an umbrella term used to describe a group of birth defects that can result when a woman drinks alcohol while she's pregnant. FASD is a broad range or spectrum of characteristics that can be physical, mental, behavioral. They also can be learning disabilities. The characteristics vary widely from person to person. To note here, FASD is a lifetime disability with brain injury that never goes away. So once again, prenatal exposure to alcohol can cause permanent brain injury that never goes away. Alcohol can damage the developing brain in a number of different ways. For example, the brain may be smaller than normal or may have missing or undeveloped parts. This is a possibility that can happen when an embryo is exposed to alcohol. Here are some statistics for you. In general, FASD affects 1 in 100 live births. In Minnesota, that's about 8,500 babies. And this information comes from the Centers for Disease Control and the Substance Abuse and Mental Health Services Administration. We're excited to announce that we found out that nationally, 1 in 13 pregnant women report alcohol use, and that number has actually gone down. And so hopefully our message is to raise awareness about the importance of identifying how damaging prenatal exposure to alcohol can be to babies. Those numbers will continue to go down. FASD occurs in all racial, ethnic, and socioeconomic groups. Another visual for you to note, alcohol use during pregnancy is a leading known preventable cause of intellectual disabilities and birth defects. So the numbers are still about 40,000 new births per year. Kids are affected by an FASD. So kids are somewhere on the spectrum. About 40,000 new babies are born on the spectrum each year. This is a really great statement. The Institute of Medicine put out a statement after doing some research in 1996. This statement says, of all the substances of abuse, including cocaine, heroin, and marijuana, alcohol produces by far the most serious neurobehavioral effects in the fetus, resulting in lifelong permanent disorders of memory, function, impulse control, and judgment. A lot of people think that especially cocaine and methamphetamines are more damaging to the fetus, but that's simply not true, and we'll talk a little bit more about this as we continue through the presentation. So some of you wonder, what about dads? And what does alcohol have, what impact does alcohol have on the sperm? We can say at this point, FAS results when a mother drinks during pregnancy. The father cannot contribute to FAS because it has a direct connection between the mother drinking alcohol and the alcohol going into the fetus via the placenta. And there is responsibility on behalf of the father to support the mother while not drinking. And some fathers actually do stop drinking for the duration of the pregnancy. And so fathers can be very important in having a positive impact in their children as well. Some research has been done linking a variety of problems in the reproductive system. But unlike females whose eggs are made during the pre-birth development, males continuously make sperm throughout their lives. Alcohol consumed by the male can enter the testicles through the bloodstream. The drug then seems to mutate some characteristics of the sperm. After exposure, they can end up with deformed heads or hindering their mobility. So alcohol does have an impact on the sperm and may impact reproducibility of the male. However, it does not cause fetal alcohol spectrum disorders. So we talked about what FASD is. It's important for you to know that FASD is an umbrella term. It's not a diagnosis. There are medical terms under FASD. These medical terms include fetal alcohol syndrome, partial fetal alcohol syndrome, alcohol-related neurodevelopmental disorder, and fetal alcohol effects. Now, fetal alcohol effects is an outdated term. Again, in 1996, they did a lot of research, and the Institute of Medicine replaced FAE with ARND and ARBD. However, you might hear a doctor or a nurse or a psychologist still use the term fetal alcohol effects. And then that's another education piece for you to talk to your doctor about, well, if I could get a specific diagnosis of alcohol-related neurodevelopmental disorder versus alcohol effects, it might help in positively with my child in the future. We don't have time to go over all of the elements in this presentation, but I just wanted to give you a sense of what the terms are currently. And we do have presentations that are more specific to diagnosis. However, in this basics training, we are giving you the terms and letting you know that FASD is an umbrella. So when we go into facial features of kids born with FAS, you hear a lot about the face of FAS. Now this picture will illustrate some of the facial characteristics that are present. As you can see, the child has a thin upper lip, a smooth, long philtrum, and the philtrum is simply the area between the nose and the upper lip. And then they have small eye openings or palpebral fissures. The blue arrow on top of the eye are the epicanthal folds, and the epicanthal folds may also be present or more pronounced in children. Other characteristics of children who have the facial features of fetal alcohol syndrome, they may have low set ears, short upturned nose, flat mid-face, and a small chin. The facial features of FAS may develop if the fetus is exposed to alcohol during a critical window of the first trimester. There is no known level of alcohol exposure that causes the facial features. Some facial features are so subtle we cannot see them with the human eye. As well, facial features may change over a broad period of time. We do know that facial features are one characteristic that we can use to diagnose fetal alcohol syndrome. These are facial features that occur in different ethnic groups, and as you can see, the facial features may be more visible in these pictures. Again, they may change or redevelop over time and become less noticeable as the child becomes older. As a result of the fact that between 6 and 10% of kids have facial features of fetal alcohol syndrome, we consider FASD an invisible disability. Because most people do not show facial features of FASD, it's important to pay attention to some of the other neurological damage from prenatal exposure that kids may experience. These symptoms sometimes persist into adulthood and include those listed on your screen. I'll give you one example of one of the elements. If you look down, number 4, it talks about difficulty with abstract concepts. Some of our kids with FASD have difficulty telling time, for instance, and this can lead to other consequences that may result from the inability of learning how to tell time and how time passes. One of our 10-year-olds loves to play on the computer, and his mother tries to get him to leave the computer, which if you have kids, you know that that can be difficult sometimes. So she tried to say, well, you'll have 5 minutes left on the computer. 5 minutes goes by, and he's still on the computer and refuses to get off. She realized that he had the inability to tell how long 5 minutes was. So instead what she did is she gave him one of those those objects that measure time by sand going through them. And once she was able to show him visually how long 5 minutes was by using this, he had no problems getting off the computer at that point. So for individuals and families who have children with an FASD or who are working with children with an FASD, it's important the difficulty with abstract concepts and to come up with different solutions to those problems. In addition to the items noted in the last slide, people with FASD may have difficulty learning from consequences. Again, in the illustration, the parent attempted to get the child to come off of the computer, and he refused to come off the computer. And consequences that may have been used for that didn't work because he was unable to abstract, conceptualize the passage of time. So as a result, the consequences did not work for him in that situation. We want to talk about alcohol and what an important role alcohol plays in preventing an FASD. If a mother does not drink alcohol while pregnant, she will not expose her child to the effects of alcohol, and as a result, the child will not develop an FASD. So because FASD is 100% preventable, we really want to stress the importance of education, and we want to encourage you after this presentation to talk about the importance of prevention, because that's how we're going to change the numbers, that's how we're going to change the experiences that families have in growing up and living with children affected by an FASD. So a couple of these slides carry our message, 0 for 9 months, and we really want to encourage you, now that you know a little bit more about FASD and the impacts of alcohol on pregnant women, to carry the message to your communities, and that way we will eliminate fetal alcohol spectrum disorder completely. So now we're going to go in and talk about alcohol. So alcohol is alcohol, and this can be confusing because of the mixed messages that we give to pregnant women in general, and the mixed messages that we give to pregnant women specifically. There are many myths surrounding alcohol, and when women who are pregnant, these myths might become detrimental and damaging to them and their unborn children. An example of this is some women think that wine coolers are not alcohol. Others think that only hard alcohol or hard liquor is real alcohol. They do not see, for example, that beer is also alcohol. There's also a myth that red wine is healthy, and although that may be true, red wine is not healthy for a pregnant woman. It's easy to fall into these traps when women are told that it's okay to have 1 to 8 glasses of alcohol per week. Take, for instance, the increase in the size of wine glasses that make 1 glass of wine into 1 bottle of wine. Also, if someone's going to have a mixed drink, like a Long Island iced tea, they may receive 3 to 5 shots of alcohol in 1 drink. So these messages are confusing, they're inconsistent, and they're damaging to pregnant women. That's why the Surgeon General put out a report in 2005. The report says no amount of alcohol consumed can be considered safe during pregnancy. And so we take that message very seriously and really advocate that no amount of alcohol, not 1 glass of wine per week, not 8 glasses of wine, no alcohol can be considered safe during pregnancy. Alcohol is considered a teratogen, and a teratogen is a substance that the fetus is exposed to that impedes growth and disrupts normal development. What happens is alcohol crosses the placenta through the umbilical cord, and alcohol is considered a midline teratogen, especially affecting midline structures of body and brain. Other teratogens are mercury, and some of you may remember thalidomide. which was a drug used in the 1950s to stop premature labor. And unfortunately, babies were born without limbs until they found out that this substance passed through the placenta to the fetus through the umbilical cord. Other factors that affect each pregnancy, it's important for pregnant mothers to recognize that prenatal exposure to alcohol may not always result in an FASD. They don't really know at this point how much alcohol it takes to affect a fetus. And not everyone has a unique brain and a unique body, so each individual has a different experience with the amount of alcohol that is consumed and how much alcohol goes through to the fetus, how the fetus interacts with that. We do know that binge drinking is especially harmful. The CDC considers 4 more drinks on any one occasion for a woman to be binge drinking. I mentioned earlier that the facial features associated with FAS form during a critical period in the first trimester. So the timing of when the exposure happens in the fetus is important. The brain does develop continuously throughout pregnancy, so again, there's no safe time to drink alcohol because the brain and the body parts are forming throughout. And the fetus, some babies are hardier than others, and they've done studies with twins, and they measured the effects of alcohol, and one twin was more severely affected than another. This is also seen in sibling groups, where some siblings may be more adversely affected by the alcohol exposure than others. Also, the metabolism and diet of the mother and the health of the mother affect how the fetus is exposed and is affected by alcohol use. And there's just no way to predict how affected a fetus will be from alcohol, and that's why, again, we talk about how there's no safe level of alcohol to consume. This is a chart that some of you may have seen. It's used quite a bit in educating folks about fetal alcohol spectrum disorders, and it's a great chart because it's visual and you can actually see how the alcohol as a teratogen affects the fetus or could potentially affect the fetus in different gestational levels of development. This chart lays out the development of a baby throughout the 9 months and shows the vulnerability of the fetus to defects during different periods of development. So you can see that the dark red portion of the bar represents the most sensitive periods of development, during which the effects of alcohol on the sites would result in major structural abnormalities of the child. So right from the very beginning, within the first 3 weeks of pregnancy, alcohol affects the baby adversely. And you can look through this a little bit more and kind of identify the different sites that alcohol goes through the fetus. But, and a lot of people think that it's not as big of a deal to drink alcohol at the end of pregnancy because the fetus is almost fully formed, where this is another myth. It's actually just as damaging, if not more damaging, because the alcohol can still go through the different parts of the brain, as you can see in the last trimester. And the skin of the baby has closed and formed. So the alcohol kind of stays within the amniotic fluid and has nowhere else to go. And so actually, you know, it's just as damaging to the fetus to drink alcohol in the last couple weeks of pregnancy. This is another chart of the same variety. So for those of you who like to have different elements of the same chart and different ways of viewing the information, this is for you. And as you can see, similar periods of development are affected as the organs develop, as the facial features start to form, up until the 38th to 40th week of pregnancy, where the baby is almost fully formed. Next, we're going to talk about developmental skills. And this is an interesting timeline for you to recognize. This graphic illustrates the differences in developmental skills for someone with an FASD, and we can say that among children with an FASD up to age 15, the social maturation process seems to be stunted at the level of a 6-year-old. So imagine an 18-year-old that can hang out, talk, they may have no cause and effect, and they may have some other difficulties. They may be getting in trouble. They may not be learning from consequences, that sort of thing. Yet they walk and talk just like an 18-year-old, but their emotional comprehension is at a 6-year-old level, and their social skills are at a 7-year-old level. So there's some difficulties in identifying some of the characteristics, especially for children and young adults who do not have facial features. They may be treated differently. And we'll talk about this in a second. Some of the young people that you'll see in the video don't want to talk about their disability, their hidden disability, because they don't think people will understand. So as a result of some of the difficulties, as a result of brain damage due to alcohol exposure, fewer than 10% of individuals with fetal alcohol syndrome and alcohol-related neurodevelopmental disorders are able to achieve success in living and working independently. So they need additional external support. We'll go briefly over effects as observed in infants along the developmental line. As you can see on the slide, that there's some pretty significant effects in infants that have been prenatally exposed to alcohol. And when these effects happen, parents may take it personally. They may feel like their child isn't connecting with them. They may feel responsible for the problems that are occurring in their infant children. An example is a mother whose daughter was inconsolable. She cried and cried and cried and cried, and the more the mother tried to console her, the harder she cried. The more the mother tried to hold her, the harder she cried. She realized her child was experiencing rejection from sensory. She didn't like to be held because her sensory input was overloaded. She just had difficulty. And it's hard to tell, of course, with infants, you know, what's going on. Are they sick? Do they have an infection? Because a lot of these elements may have to do with other things as well. But these are more common impacts that infants affected by an FASD have. As a child grows, they may have difficulties with developmental delays. They may continue to have sleep problems. They may continue to have sensitivity to sensory input. They may get angry or frustrated often. They may have an early diagnosis of ADHD or autism. They may have a lot of difficulties in early childhood education and starting school. As they get older, they will continue to experience the problems that they did in younger years. And in addition, they may have difficulties, again, learning from consequences. They may relate better to younger children or older adults. They may be impulsive, and they may not be able to follow through with simple tasks. Again, I described difficulty in understanding abstract concepts, and so that's something that you may realize as time goes on, that the children may have more difficulty throughout their teenage to young adult years. Some of you may have heard the term executive functioning, and basically what this means is the part of the brain that's impacted by an FASD holds executive functionings for people who have an FASD. The executive functions are extremely significant when understanding the implications of brain damage from prenatal exposure. For example, it took executive functioning for you to come to this webinar today. You might have put it on your calendar, remembered to log in and call in, and if you had difficulties, you figured out a way to troubleshoot your way through. But for young people and young adults affected by an FASD, the executive function does not exist. And so as a result, researchers and advocates, they claim, and I agree with this, that those affected by an FASD need an external executive function, meaning that there may be tools that are useful in promoting getting to class, for instance, on time, or doing your homework after school on time and completely, doing chores and working cooperatively with your siblings, or that sort of thing. And so this is something that we will not get too far into in this presentation. Again, this is a general FASD basics presentation, but for future reference, and this is something that you may want to look up, the idea of executive functioning. At this point, I'm going to show a couple of short videos, and so if you will bear with me, I'm going to show you my desktop and pull up some videos. They're really great videos. The first one that I'm going to show was done, it was a video developed by young adults here in Minnesota, and this will give you a little bit more information on how young adults view their diagnosis with an FASD.
as if I were someone without a disability.
I don't really tell people that I have it. Like, it's hard to tell someone that you have a disability. And, like, I've only told a few friends, but, like, I'm not ready to tell them yet. I feel like a lot of people don't understand. To other people, not really noticeable, but certain things just don't work. It's very frustrating, actually, because if I were to tell you what FASD means frustration. It doesn't have to be difficult. There are people that make it easy.
My parents have always been there for us. They've always advocated for us. Things that have helped me feel supported in life are my parents, and also like my therapist.
Having, like, somebody to talk to, have somebody that you can go to and just lean on, really is a big stress relief. I'm so thankful for the teachers that I had because they understand that it's hard. They have done so much to make it easier for me to live every day.
March 19th.
March 19th.
March 19th.
On March 19th, I will be on the state council to raise awareness
About FASD.
Will you join me there?
The next video I'm going to show is a short video that some of you may have seen. And I'm not sure how this came across to some of you who are on the phone or on the computer, but you can watch the Struggles for Young Adults in Minnesota on YouTube. And that's basically where I got this from. The Story of Eyal is also on YouTube. It's youtube.com/watch-TV, and it's called The Story of Eyal. So I'm going to attempt to play this video as well. So hold on, please.
We started seeing a lot of hyperactivity and emotionality. So we started getting a little concerned. When we first saw the developmental pediatrician, he suspected that there was an underlying syndrome due to fetal alcohol exposure. A diagnosis gives you some validation. We can say this is a disability that is a result of a birth defect. Living with a child with fetal alcohol syndrome is like living with the constant anticipation of a hurricane. Over time, you understand on so many different levels how this impacts not only your child, but your family. It's very hard to be a sibling of a child with fetal alcohol spectrum disorders. It's hard as a parent not to put this burden on your typical kid because it's like you want to say, you're the easy one, don't act out. We know there is no magic bullet. There is no one thing that is going to change everything. Having some OT in speech and physical therapy certainly helps. And you want to try to teach social skills to your child. But I think the intervention that I am most excited about is that we obtained a service dog. Eyal has an unconditional companion. One of the things we've learned as parents is that you want to try to create external supports for your child so that they can feel successful in any environment possible. The earlier you have a diagnosis, you can start intervention. If you see some behaviors in your kids that might look like what I'm describing, you certainly would want to make sure that you have a pediatrician answering your questions or your concerns, that you go to some sort of specialist, either a child neurologist or a developmental pediatrician. You have to look at this in the face so that you can help your child. I think it's important to tell the truth, to talk about what this is, and not to be ashamed, because if you're going to teach your child to be an advocate for themselves, you have to say, this is my kid. Part of my kid is that he has a disability, a profound disability. Every parent wants their child to be happy, and certainly that's what we want for IAL. I think finding happiness within the context of their disability is going to depend a lot on IAL feeling safe. Because he's so vulnerable, it is going to be our lifelong job to keep him protected and safe. There are forks in the storm. You just have to look for them.
Okay, so those are two great visual documentations of stories of children and young adults who are affected by an FASD, and I would encourage you to look for more examples of that to share with your own family or share with your community. And the more, like the story of IAL, the more we talk about it, the better things we'll get for our entire community. This slide represents the tip of the iceberg and is not something we will have time to go through today. If you'd like more education on intervention strategies, please contact MOFAS or contact your local Fetal Alcohol Spectrum Disorder organization or clinic, and they can work with you, or we can work with you to come up with some tools for you to use. Like I said earlier, we talked a lot about the challenges that individuals affected by an FASD experience. And it's not just the individual with an FASD, it's the family, it's the community, it's everyone who's impacted by an FASD. So here are some strengths that we've gathered that are pretty universal to individuals affected by an FASD. So it's important for you to keep in mind that there are always positives that go along with the diagnosis of an FASD, and we should focus on the positives as a community and in order to become stronger and to grow. The Minnesota Organization on Fetal Alcohol Syndrome has a virtual family center, and you can go look through our virtual family center on our website, and we also are connected with FastLink, which is a large support group with over 300 members. We also house a resource directory that may be important to those of you who live in Minnesota. You can find local resources in your community if you live in the Twin Cities greater metro area or in greater Minnesota. It's a very comprehensive list of organizations and service providers that we work with on a regular basis to raise awareness about FASD and also to help individuals and families affected. And then, as you can see, the CDC and other resources are available to you to get information on the latest research that's done in the area, statistics that may be important for you, or access to different strategies that have been tried and true in working with kids and working with young adults who are affected by an FASD. This is a great statement, and it's one that we talk about quite a bit here at MOFAS. This is a popular saying amongst parents and caregivers of youth with an FASD. It's a reminder that it's our responsibility to create an environment in which individuals and families affected by an FASD will be successful. We have about 10 minutes for questions, so I'm going to see if I can't access this and make it a little bit larger so I can see questions. I'm going to go ahead and attempt to respond to your questions, and like I said, if you don't have any questions, or if I don't know the answer to your question, I will come up with the answer and email it to you. So this presentation will be made available to you. We have recorded this presentation, so it will be made available to you afterwards. What I'm going to do is, after this webinar, I'm going to email you with a couple of questions about the presentation, and if you could respond to me with your answers, then we'll send you a certificate and a link to this presentation. If you have any questions, you can chat them down at the bottom. Okay, if there aren't any questions, I would just like to thank you very much for attending this webinar made possible by the Minnesota Organization on Fetal Alcohol Syndrome. We were very excited to present this information to you. If you have any questions, or if you want more information from us, you can contact me directly. My name is Stephanie Kolari. I'm the training manager with MOFAS, and I would be happy to answer your questions afterwards and to provide you with any resources, either locally, or if you're listening in from California, I could make contacts for you in your region. So anything that I can do to be helpful. I also want to encourage you, again, to spread the message to prevent fetal alcohol spectrum disorders, and also to support individuals and families who are currently affected by an FASD. I'm going to go ahead and end the webinar at this point. I have one more slide for you to leave you with, our contact information at MOFAS. We have an office in St. Paul, Minnesota, and our phone number is right down there at the bottom. We have an amazing website, so if you're looking for any information, either locally in Minnesota, or if you're looking for some great information and resources if you're outside of Minnesota, please go to our website and check out all of the great things that we're doing, both to prevent fetal alcohol spectrum disorders and also support individuals and families who are affected by. So again, thank you for coming, and our next webinar will be on November 7th. And I hope that everybody has a great day.